I currently am a family doctor, and I work at Kaiser. And I'm just really excited to be with you all. I know it's a virtual setting, so it's not the same. I would love, love, love if you guys can turn on your cameras, if you can, because then I'll feel like I'm actually with you, and I don't mind if you're in your PJs. Um, thank you. And I'd really love for this to be kind of interactive. And, I actually have some questions for you too, and I want you to feel comfortable asking me whatever you want. Okay? So I just want to make sure everyone can hear me clearly. So my first question is, and I guess I'll pull up the chat too. Does everyone want to be a doctor? What do you guys want to be? Is this why you're all in this group? I saw a so-so. Okay, Adriana does. Lucas does. All right, so I'd like to, I know, I read a little bit about your program, and like Vivian, I actually also went to Lowell High School, so I'm a Lowell High School graduate. What I'd like to know is what middle school you all go to. So if you guys want to put it in the chat. I see AP Giannini, St. John's, Bayside. Oh, a lot of people from AP Giannini. Anyone from Aptis? Next year, hopefully. Presidio, nice. All right, so I could sit here, of course, and tell you all about my path to medical school and being a doctor, but I want to make sure that I talk about what you guys want to hear. So do you guys want to start with any specific questions about being a doctor or the path that I took, or questions about your health even? I'm open. I don't hear anyone.
I think a lot of the students are curious about like a typical day for you and how that's changed because of the pandemic.
Yes, so as you can imagine, the pandemic has changed a lot of things. My typical day before was I go to the clinic, and if I'm working a full day, sometimes I would see up to maybe 24 patients a day. Some of them were in person, and maybe a handful would be what we call virtual visits. So we do see patients the same way I'm talking to you right now, on a video visit or a telephone call. But the majority of the patients I was seeing in clinic, so I was examining them, listening to their heart, listening to their lung. If they had a skin condition, I was looking at their skin. If they had joint pain in their knee or in their shoulder, I was, hands-on examining their arm or leg. And with the pandemic, we went into almost what we call 100% virtual care. So what that means is my day now looks very different. Basically the same way I'm talking on a video to you, I'm providing patient care like that. So if somebody has, let's say, a rash, either they're showing it to me on the video, or sometimes they're sending me a picture, and I can look at the picture and diagnose it. And if I'm not sure actually what it is, I have the specialists, the dermatologists available, and I just forward the message to them, and then they'll give me advice. And then if the patient needs medicine, I order it also electronically, and then it gets sent to the pharmacy, and then the patient can get it in the mail. So that's the other thing. We made all medicine available through the mail, so that patients don't even need to come to the pharmacy. They can get it delivered. And we even set up same day. So we're trying our best to minimize patients getting exposed to COVID, and we're doing everything virtual. So you name it. So I'm a family doctor. So a family doctor We're also sometimes called primary care doctors, but there's different kinds of primary care doctors. The way that a family medicine doctor is different is that I see patients of all ages. So I actually see newborns, so who are just born like 2 weeks old. I do we call it like the well baby visit. So I do newborn visits. I'll do well child checks for kids, babies, infants, toddlers, kids your age. I have teenagers as my patients, and I also have adults. So I have patients up to their 90s. And that's why I love family medicine, because I get to take care of people of all ages. And I also do women's health. So I enjoy doing that as well. In my old clinic, I actually even used to provide care for pregnant women too. So as a family doctor, you can even deliver babies if you want. So I have delivered babies in my training, but where I currently, what I choose to do right now though, is just work in the clinic, not in the hospital. But I am trained also, if I want to work in the hospital, I can do that too. All right, I'm gonna look at the questions. When did I figure out I wanted to be a doctor? How did high school help me? All right, so I'll be honest, I knew I wanted to be a doctor since I was a little kid. I remember probably being 5 and thinking I wanted to be a doctor. Of course, when I was 5, I did not know what being a doctor meant. I just remember having like this little plastic box with a plastic stethoscope and the plastic, doctor toys. And I'm the oldest of 5 kids, and so I used to pretend I was the doctor with my younger siblings. But that was all in play and fun. But I did know I wanted to be in that field since I was really young. And so my whole life, my focus was just school, and I knew it was a really long road, so I'd kind of like mentally prep myself, I want to go to a good high school, I want to go to college, I want to go to medical school, so I knew it was a long path, but it was something that I really wanted to do. High school, I went to Lowell High School, and so Lowell is great. Actually, a lot of the schools in the city are wonderful because they have so many opportunities to take different kinds of classes. I did take a science class probably every year, but the classes that were fun were probably the electives. I really enjoyed art class. I took ceramics. I did music. So I think the important thing is to be well-rounded and really take classes that you enjoy. Because if you take classes that you enjoy, you'll do good in your other classes because you'll be happier versus taking classes that you're really not enjoying. So I'll give you an example. When I was in high school, when I was in college, I went to UC Santa Cruz. You guys heard of the beach boardwalk? I used to live across the street. So I went to UC Santa Cruz, and I initially majored in, okay, this is a long name, molecular, cellular, and developmental biology. That was the name of the major. So just think biology, science. And I remember one day, I was looking at the classes I was taking, and it was biology and chemistry and calculus. And then I was looking at my friends and all the classes they were taking, political theory, intro to feminism, art classes. And I was like, they sound like they're having a lot of fun. Like I don't want to just take science classes. And so I actually decided to double major. And so my major, my second major, was called community studies. And community studies major deals with social justice, and you do a local internship to prepare you for a longer internship that was 6 months. And a part of that major is those 6 months, even though it was during your college time, you could go to a different country. And so my family is originally from Palestine. And so I actually went to Palestine, and I got a chance to work in the refugee camps and work with children and human rights organizations. And I really feel like that was a really big motivator for me to travel to a different country and work with children and work with human rights and education. And I feel like that just really helped to give me the motivation, to continue my path of being a doctor. And so I do urge everyone to diversify what you like, or what you want to study. And I've met doctors who majored in music or majored in art. So you don't have to major in a science, but what happens is, because there's a lot of requirements, right? So when you, to get into medical school, there's a list of requirements. And those requirements pretty much almost equal the requirements of the major, right? So that's why most people have a major in science, because that's what's required. But some people can, you know, there's a difference. So there's something called a minor or a major. So sometimes for the minor, there's a little bit less requirement. So some people can have a minor in science, again, because, right, all those classes you're gonna have to take to get into medical school. And then they major in French or Spanish, or, like I said, I've heard people major in all sorts of different things. I just wanna make sure I answered your question. If someone could read me the questions from the chat, so we can, it'll help me, so I don't have to go back and
Yeah,
forth.
of
But
course.
I
So
think it comes up to me.
yeah, Ryan was wondering, where would be the first place you would go after the pandemic?
My mom's house. I live like 2 houses down to my mom. And I haven't been inside her house like since the pandemic started. We just meet outside. Like I'll tell her, okay, mom, bring a chair, let's go sit outside, and we'll sit like farther than 6 feet apart with masks on, because you know I do see patients sometimes, and sometimes we get assigned to work in what we call the respiratory tent. So we've actually set up outside tents for people who are sick, so that we can see them in a way that doesn't have them mix in with the other healthy people who are coming into the clinic. And so you can imagine I'm wearing a face mask, you know, I'm wearing a lot of, you know, we call it PPE, personal protective gear. So I'm wearing a lot of that, and it's you know, more to be safe. And my sister had a baby also during this pandemic. And I think after this is over, I just want to carry her because she's already 6 months old and I haven't held her. And she also lives in the neighborhood, so I get to see her from really far away. So I think, you know, it'll be nice to, you know, I think we sometimes take advantage of just the connections that we have with people, our friends, our families. I actually have a daughter in middle school too. So she really, really misses school a lot, and she misses her friends. And so, you know, it's not an easy time. But we are in a situation where I think, you know, if you can meet at a park and make sure you have your mask on and you're, you know, 6 feet away, I would recommend to be outside, because I think we need it. We can't just be inside. I mean, unless people are sick or have a medical condition, right, and they're higher risk. But other than that, you know, I do think it's good to have some kind of connection. Even if it's virtual, that's good. But if you can be outside and you have that option to do it safely in an outdoor park, that would, you know, that's okay. But not involving food, because when you eat, you have to take off your mask, and that increases the risk.
Yeah, definitely. Ashley was wondering if you could talk about paying for medical school.
Yes, so unfortunately, I had to take out a lot of loans to go to medical school. And, you know, it's an unfortunate part of what we call, you know, higher education, unfortunately, because it is really expensive. What I would recommend, you know, I think before people used to think they had to be in such a hurry and, you know, just right after high school, I'm going to go to college, and right after college, I'm going to go to med school. You know, I do think it's okay somewhere along there to work. Like I worked during college, you know, I worked in the student clinic, I worked at the gym, the school gym, you know, I just did different kinds of jobs. And, you know, I think, you know, try to not overspend, you know, and save. And, you know, if you have family, I mean, this is looking back now, right? Kind of now I think I have a better idea of what the options could have been. I would recommend, if there's a way for you not to be in so much debt, I would recommend it, but it's hard, right? Because school now is so expensive. Even undergraduate is so expensive. They have a lot of scholarships, you know, so there are a lot of scholarships. You can look into those, and some of them are based on different things. So some of them are based on the financial situation. Some of them are based on your grades. Some of them are based if you have a special talent, right? You can get a scholarship if you play a very specific instrument, for example, or if you're a really good athlete. And some of them, if you're a first-time college, if you're the first person in your family to go to college, there's a lot of different ones. And when you get to high school, your counselor will help you with that. They have like books of all the different scholarships. There's that many. So I think the key is when you are in high school to develop a good relationship with the counselor, and that's their job to help you, because it's not something you can do by yourself, to be honest. It's a lot. So high school counselors are awesome and they'll help you. What else?
So Rowan wanted to know, do you have to major in biology or medical related things in order to go to medical or nursing school? I think we touched on that earlier.
Yeah, so what you have to do is take the requirements. So there's a list of required classes, and you have to take those classes. That's true for nursing school, for any medical school. Now, sometimes those classes, if you add on a few more classes, like a few more science classes, that just becomes the biology major, for example, right? Because they set it up they set it up that way. But as long as you take the requirements, that's the most important thing. And you can major, like I said earlier, whatever you want. You could be an art major if you want, as long as you take the requirements for the science, for the pre-med requirements. Does that make sense? Because a lot of people don't know that. I think you have to be either like a biology or a chemistry major. I think you have to remember that there's so many people who are applying for the same thing. So I want you to think about how you're going to stand out. How are you going to be different, right? What are the experiences that you're going to have along the way to show, number one, that this is something that you really want to do, but number two, that you are unique and, have talents and can bring things to the table that maybe other people can't.
Yeah,
so you have time for that. I think volunteering is really important, and volunteering in different things. So I know right now that's challenging because everything is on hold, but once things are opening up again, any kind of volunteering I think will be good. They have beach cleanups, they have canned food drives, clothing drives. They have programs where you can work with children to teach them to read, or even work with adults to teach them to read, right? There's a lot of different categories. And, I think it's just important to work with other people, and that also helps you to learn what you enjoy doing too.
Yeah, Anika wanted to know, what classes did you take in high school that helped you in college or medical school?
That's a good question. So I think what helped me was probably actually my classes in middle school. I went to a Catholic middle school, and they had us write a lot. Like we had to do lots of book reports and essays, and we had to read. I mean, I think I enjoyed reading, so I also read a lot. But I do feel that the writing helped a lot, because you do have to write essays in college and to get into college even. So I want you to think of the foundation, right? You're kind of building a foundation right now, right? Of good reading skills, good writing skills, vocabulary skills, comprehension skills, right? And you build on that for your whole life. I mean, you're gonna learn. We continue to learn. You don't stop learning. But I think this is a good time to read. So pick any genre of books that you guys enjoy and start reading. And why? The important thing about reading, even if it's just a storybook and it's not related to anything you're studying in school, is when you read, you do become a better writer without even working at it. And you also build your vocabulary without even trying, right? It also increases your reading comprehension. And you need reading comprehension for any class, right? Whether it's a science class, an English class, any kind of class. So I would say increase the amount that you read. I would recommend, if you think you have no time to read, take your phone, go to your screen time, and see how many hours you spend on your phone every week. I guarantee you it's a lot, because I know I did it for myself recently and for my kids, and it was a lot. So I looked at that number and I'm like, oh, okay. Because I even sometimes think I have no time to do anything. But then when I looked at my screen, like, oh, okay, if I spend that many hours a day on my phone, that means I probably have an hour to read a day, right? Which I don't do. Wow, somebody said 3 hours a day. Just know that is pretty extraordinary. Two, okay, so I do this with my patients who are teenagers. Some of them average 10 hours a day, more than 10 hours a day on their phone. No phone. Wow. Okay, that is really smart. um, wait, a bunch of you have no phone? Adriana, is that? And Viviana, are they saying have no phone? Wow. Okay, so let's talk a little bit about that, if you guys don't mind. It's kind of related to medicine because it is related to your health. You know, we know that, you know, the scientists who work on these, they're basically working to get us addicted to this phone, right? And the apps and the games and all of it. And it's not a conspiracy theory. You know, I'm sure you guys have heard there's documentaries about it, articles about it, books about it. And so it is really, it's really hard to, I think, have an iPhone or like a smartphone and then try to limit how much time you're on it, right? That's a hard thing to do even for adults. So, you know, I would say look at your screen time. For those who are under 5 hours a day, that's great. And anyone who's above 5 hours a day, I would just ask you to kind of consider how you can cut it down. And you know, when you go click see all, it tells you, it breaks it down by what app, right, you're spending how many hours on. Because the thing that's really important at your age right now is sleep. That is one of the most important things right now for you, for your health, for your brain development. You know, when you sleep, your brain is actually processing information, right? And what happens is these phones actually emit a certain kind of light. And what that light does is it suppresses this chemical that helps your body to go to sleep. You guys heard of melatonin maybe, right? So you need melatonin so that you can sleep. And these blue lights that are emitted, they suppress that, and then it makes it harder for us to go to sleep. And sleep is really important for development. So I would say make sure you're getting enough sleep. Make sure you're getting some physical activity, like an hour a day is the recommendation. So I know it's a little bit challenging. There's no PE class, or maybe some of you are having virtual PE class, but it's not even every day, I think, right? So, you know, it could be just going for a walk. If you want to get a bike, if you don't have one, I would recommend that and just go for a bike ride. They have YouTube exercise videos, a lot of them. If you like to dance, you can just dance in your room. Just pick something to get you, moving, because exercise, so movement is important. It's an hour a day recommendation for your age group. And sleep is important, and making sure you're eating healthy. So things like whole grains and fresh fruit and fresh vegetables, diversifying your diet, making sure you're eating healthy things that are not from a can or a box or some plastic bag, right? Because that's not real food. That's processed, all of it mostly. All right, anything else?
Yeah, Ashley wanted to know about your residency, like what it was like, and she asked, was it like super draining or is it survivable?
Oh, I'm here in front of you, so I survived. It is survivable. It is tough. They've changed some rules though, actually, so that you don't have to, we used to have overnight shifts. So I have worked 100 hours in 1 week before. many times, but they've changed, they've changed some of those rules. So you're not going to be working those many hours anymore. And we used to do like 30-hour shifts straight. They don't do that anymore either, because they care about safety and, they want the medical students and the residents to be healthy and, have slept well, because we know that when you sleep well and are rested, you make better decisions, so it is survivable and it's doable. And I think it also depends on what program you go to, right? So there's different kinds of residency programs and they're different. I wanted to do mine at what's called a county hospital. Are you guys familiar with San Francisco General Hospital, right? So that, for example, is like the San Francisco County Hospital. It means like people who don't have insurance, they go there, right? That's the hospital for kind of everybody. And I wanted that kind of experience because I wanted a more diverse experience. And I did mine at, I don't know if you've heard of it, San Bernardino County. It's kind of a couple hours away from Los Angeles. And I chose to do mine there because I felt like it would provide me with a lot of opportunity to see a lot of different things, which I did. I'm really lucky in that I feel like I've seen it all with my training because, again, it was a diverse patient population. So yeah, you get to pick once you're at that stage. You don't get to pick where you go. You pick where you want to apply, and then one place. You get picked by just one place to do residency. I think the most important thing right now, are you guys in 6th, 7th, 8th grade? Mostly? What grade? 8th? Okay, so it's a mix. Yeah, I think right now the most important thing is kind of knowing what your strengths are in terms of school and recognizing what areas you need help with, right? Like what subjects are more challenging for you, and really focusing on getting help in those subjects, right? So that you can grow and learn and that you don't feel like you're limited in how much you're learning. So I think this is a good time for that. So for example, if you love math and you're so good at it, all right, great. So go see what's a challenge for you, right? But if math is something really challenging for you right now, then this is the time where, you can get help from your teachers, maybe even get a tutor, right? Because again, it's kind of like a foundation and you're building the blocks. So you want that foundation to be solid. And this is a good time to kind of develop that foundation. People mention, reading, writing, and math, but it's about so much more than that, right? A lot of it is about critical thinking, and critical thinking is usually not a class, right? So that is going to be based on, again, reading different books. Maybe if you enjoy reading about current events, you can read some of the online newspapers. Just reading about different things is important. All right. What else?
Yeah, so Juliet was wondering, did you do any internships? And if so, can you recommend some?
I did. So the internships that I did were in college. I do know of some people who did internships when they were more your age in high school. So they are around. I just didn't know about them that much when I was your age. You have to remember we did not have the internet. So everything we knew, we just had to hear from someone else. So you guys are really lucky you have so many resources and you can find out about a lot of different things. So let me give you some examples of some things you can get involved in. So they have, for example, I think it's still there. It's called WIMAC. They have the like the Youth Commission with San Francisco City Hall, right? They have all these different youth programs in the city. And I don't have a list, but maybe we can work on, gathering this list so that you have these resources. And they do offer a lot of opportunities for youth. And sometimes they're in like public health, advocacy, education, lots of different things. So I would have to kind of, get a list, and maybe I'll share, we'll gather some to give to you. So those are some internships. They used to have internships like at the hospital where you would like volunteer, this is just an example, like you could volunteer to like read to the kids who are in the hospital and they're sick. This is not, of course, during a pandemic right now. I'm just giving you examples from when I was in high school, what some of my classmates I remember were doing, or just like volunteering in hospitals to do different things. And they had some programs for high school kids too. Middle school, like I said, I don't know if they had programs for you to be in the hospital, but they definitely have just a lot of volunteering opportunities in general in different kinds of organizations. And they even have things that you can get paid for. So they give you what's called like a stipend. So let's say you do a 6-month internship and, they pay you at the end too for your time. So for example, if you guys have, you've heard of Stanford University, they have like a smoking cessation. It's like a program to help teach kids about the dangers of smoking and vaping. And they have a youth committee. And so the people, the kids who are on the youth committee, they're in high school, and they meet like this virtually every couple of weeks, and they kind of put together projects that they can share with other youth. So that's one example. Again, that's high school, but I'm sure there's also programs like that for middle school.
Yeah, and I think a lot of the activities that you're involved in, especially at the middle school level, they don't necessarily have to be related to medicine. Like anything related to science,
Yeah.
or even like volunteering at the food bank or the library, that is also a valuable experience. Am I correct on that, Dr. Elkarra?
Absolutely, yes. You do not have to volunteer in a hospital. Like I said, I went to go volunteer in a refugee, in refugee camps. And I worked actually on one project where we were trying to build a library, because that's what the children had determined was like their priority. That's what they had wanted, so it's, there's so much out there. I do think volunteering is important. So put that as, some kind of priority where you do a few volunteer projects, every school year. And like you were mentioning, it could be, something with the library, a volunteer project, cleaning up the beach, anything. They have even I think that somebody said they wanted to be a veterinarian. I think they used to have a program there where you can help with the animals. They have programs at the zoo, right? They even have programs where it's not really volunteering; it's actually a job. They have youth jobs, right? They have this really cool program. If you're in the if you live in the southern part of San Francisco, you can work with like restoring urban, like McLaren Park and outdoor spaces. There's programs where they teach you how to like plant vegetables and do all, there's a lot of different things. I agree to just kind of get involved in different things so that you can find out what you enjoy, right? I think at the end, it's really about what you enjoy. And remembering, being a doctor, the idea of what a doctor is one thing, and what we do is a little bit different, because a lot of people they think it's like what they see on TV or the movies or the shows, or, that's not really what a doctor does. When you're a doctor, there's, first of all, so many different kinds of doctors. So I'm a family doctor. There's dermatologists. They study the skin and the diseases of the skin. There's neurologists. They study more the nerves. There's radiologists. They're the ones who read all the X-rays and the CTs and the MRIs and the ultrasounds, right? Those are all the different kinds of imaging that we get. And, there's surgeons. There's OBGYN doctors who do, women's surgeries and deliver babies and provide care for pregnant women. So there's a lot of different kinds of doctors. And I hope when the situation's a little bit better, and maybe probably when you're in high school, I would recommend to see if you can shadow a doctor for a day, because that will really give you an idea of what it means to be a doctor. So I hope that that will be an opportunity for you when you're in high school. And I know we have just a few minutes, right? I just want to, is this done at 10:40 or 10:50?
It ends at 10:40.
Okay, so there's 3 minutes. I don't want a little bit longer if anyone just has questions they really want to ask. I don't mind. So I do want to make sure though we, kind of close it up for everyone. I mean, I think you guys asked a lot of really great questions. It is a long path and it's a very rewarding one. I can't imagine doing anything else in the world. I wake up every day, very excited to do the work that I do. It's really, really rewarding. Is it hard? It depends what you define as hard. I think everything is hard a little bit, right? There's challenges, but I think in the end of the day, you have to ask yourself, what kind of job do I want where I'm going to wake up and do this job every day for however long you want. And that's not an easy question to answer, and I don't expect you to have the answer. But the good news is you have a couple of years, actually many years. You have many years to figure this out. So you have high school, even college. Not everyone who goes to college knows exactly what they want to do. And some people, they go in as an undecided major and then they pick a major later. Or some people go to city college, right? Because they get a chance to take a lot of different classes to kind of figure out what they want. So I'm just one example, right? I knew that I wanted to be a doctor, but there's a lot of people who have very different paths, to their careers, no matter what kind of career that they have. So I want you to just, I think for now, figure out what your strengths are in your school, figure out, in terms of your classes, figure out what your challenges are and work on those so that they don't become as challenging. And if you have questions, I will leave my email address with you, okay? So that if anyone has a question, you can email me, I don't mind, okay? So we'll send it out to an email to you all. And what else? I think I actually reviewed all the questions that were sent in, the ones that you sent me. I reviewed them all, and they're all really good. Bless you. Bless you again. So again, the questions you guys asked were really, really good. And people even asked about steps like MCATs and USMLE.